We are staying with the health news because COVID-19 infections continue to surge across the nation, that according to the CDC. Updated COVID-19 vaccines are now available, but there's also widespread confusion about vaccine recommendations and access. So to help navigate this uncertainty is former U.S. Surgeon General Dr. Jerome Adams. Dr. Adams, thank you for joining us here this morning.
Good morning.
Well, good morning to you. So let's talk about this approach and what everyday Americans should know right now about COVID-19 availability for a vaccine.
Well, the big change that we're seeing is that instead of recommending COVID-19 vaccines for all adults, which was old policy, the Advisory Committee on Immunization Practices now advises what's called shared clinical decision-making, which means it's up to patients and their healthcare providers to decide based on individual risk whether or not we should all get our COVID-19 vaccines. It means it's more important than ever to have an open conversation with your doctor, your nurse, your pharmacist, because they can help assess what's going on in your life and decide what's right for you and your family.
How should people navigate this conversation with their healthcare providers? What should they be asking, and when do they need to know that they need the vaccine for themselves?
Well, if you're over 65, you absolutely should be strongly considering the vaccine. Seniors were 24 times more likely to be hospitalized last year if they got COVID-19. If you're pregnant, you should be strongly considering it. That's not me saying this. This is the American College of Obstetricians and Gynecologists saying pregnant women are at high risk. Young people, particularly young children, again, are the second highest risk group for being hospitalized for COVID-19. And 70% of adults have a risk factor for negative outcomes from COVID-19. If you're high blood pressure, someone with high blood pressure, if you are overweight, if you're someone who has asthma or diabetes. So me and my wife, we got our COVID-19 vaccines and our flu shots just last week. And I got my kids their COVID-19 vaccines and flu shots because I don't want them to get long COVID. I don't want them to miss school. I want them to have a safe, a happy, a successful school year. And so I did it for my family, and that's why I recommend for your viewers that they talk to their healthcare providers and consider whether or not a flu and COVID-19 vaccine are right for them.
There is a growing concern for people that might need a prescription or a doctor's authorization to get the vaccine now. Is this accurate, or what are the practical implications for Americans trying to stay protected?
Great question, and it depends on your situation. That's part of the problem. Because of unclear federal guidance and a patchwork of state rules, access now varies by age, insurance, and even which pharmacy you visit. But if you're over 65 or have an underlying condition, you should still be able to get vaccinated without a prescription, especially in North Carolina. I spoke with your governor just a few weeks ago, and I feel confident that he's going to do everything possible to make sure people in North Carolina can access COVID-19 vaccines. But if you're younger or at a lower risk group, the process may become harder. And that's especially concerning for the 26 million Americans who don't have a regular doctor. For them, a prescription becomes a barrier and not a safeguard.
Yeah, exactly. So help us understand what we're seeing now, this surge of COVID-19. Why are we seeing these high infection rates? What's driving this situation?
Well, we get new variants regularly, and it's important to remember that COVID is now like the flu. It comes around every year. It shouldn't be something that we're scared of, but it should be something that we're aware of and that we protect ourselves from. COVID killed more people than breast cancer and car wrecks last year. So you put on your seatbelt, you get your breast cancer screening, and now we need to be thinking about making sure we're getting our COVID-19 and flu shots every year. We say flu before boo, right around Halloween season. And that's just what I want people to understand. Get away from this all or none, COVID is just a cold or COVID's going to kill you mindset, and just understand it's something we can and should be protecting ourselves from. Talk to your doctor. Talk to your pharmacist. You can go to cveep.org and get more information about all vaccines and find out where near you you can get an updated COVID-19 vaccine.
All right. And then for those who might feel like this changing guidance means COVID is no longer a serious concern, your message to them this morning, Doctor.
My message to you is that you should talk to your provider, understand your risk, and make sure you're doing what's right for you and your family. But understand, I'm a former Surgeon General. I'm a practicing physician. I got my COVID-19 vaccine. My kids got theirs because I want to protect my family. And I have a mother in a nursing home. I want to make sure I'm protecting her and lowering my chance of giving her COVID-19. And so, again, it's something that we can deal with. We have tools, but the tools don't do us any good if we don't utilize them. So talk to your doctor about what's best for you.
All right, Dr. Jerome Adams, thank you so much for the information and for the important conversation as we are up on the flu season now, as well as seeing this surge in COVID-19 cases.
Thank you.